I bet you did not know that there are 8 different types of professional cleanings. Today, I will be unpicking the difference between two of them, a routine and deep cleaning. It is a distinction that's key for your pearly whites. So buckle up as we unveil the mysteries behind the dental cleaning process. You must know that dental cleanings are not a one-size-fits-all process. Most can be categorized into routine and deep cleanings. A routine cleaning, also known as a prophylaxis. It is like a regular tune-up for your mouth, aiming to maintain oral health by removing plaque and tartar. On the other hand, a deep cleaning or scaling and root planing is a more comprehensive procedure, often recommended when gum disease is present or there's a significant buildup of tartar below the gum line. The tools of the trade for these cleanings include the ultrasonic scaler, which uses high-frequency vibrations to break down tartar, and the dental scaler, a handheld tool used for more detailed work. You might also encounter the Prophy cup, a small rubber cup used to polish your teeth. A crucial part of the cleaning process is a dental examination, x-rays, and visual inspections. This gives your dentist a comprehensive understanding of your oral health and gum measurements. Remember, your dentist tailors your dental cleaning to your specific needs, guided by detailed examinations. It all depends on the severity of your gum inflammation and infection. One common concern during dental cleanings is tooth sensitivity. This can often be due to exposed dent and receding gums, or even thin tooth enamel. But don't worry, there are ways to manage this one, as by using a desensitizing toothpaste like Sensodyne before your dental appointments. Also, your dentist can use numbing agents during deep cleanings to alleviate any discomfort. Remember, communication with your dentist about your sensitivity can make a big difference. With the right approach, sensitive teeth can be successfully managed during your dental cleaning. Now let's talk about dental cleanings for those with braces, crowns, or veneers. These dental fixtures can present unique challenges during the cleaning process. For instance, braces may make it difficult to reach certain areas, while crowns and veneers require gentle cleaning to avoid damage. That's why dental professionals employ specialized tools and techniques to ensure a thorough cleaning without causing harm. When it comes to braces, interdental brushes and water flosses can be a game changer. These tools can reach those tricky spots between brackets and wires, helping to keep your teeth and gums healthy. As for crowns and veneers, a non-abrasive toothpaste and a soft bristle toothbrush can help maintain their shine and integrity. Remember, even with these special fixtures, the golden rule remains the same. Brush twice a day, floss daily, and don't skip your dental checkups. Whether you have braces, crowns, or veneers, regular and thorough dental cleanings are a must. Your at-home dental care routine plays a vital role in maintaining your oral health. It's essential to use the right tools for effective cleaning. A soft bristle toothbrush is gentle on your gums, reducing the risk of irritation. Electric toothbrushes are also a great choice, as they can remove more plaque than manual brushing. The use of a water pick can help dislodge food particles from hard-to-reach areas, while regular flossing is crucial for preventing gum disease. Consistency is key. Aim to brush your teeth twice a day and floss at least once. Regular care keeps your teeth and gums healthy between professional cleanings. After a dental cleaning, it's normal to experience some sensitivity. A warm salt water rinse can provide comfort, helping to soothe your mouth. Remember, the key to good dental health is consistency in your at-home care routine. We've covered a lot today, from understanding the different types of dental cleanings to managing sensitive teeth and maintaining good dental hygiene at home. We've learned that routine cleanings are preventive, while deep cleanings target more serious issues. We've also explored the various tools used in the process, such as the ultrasonic scaler, dental scaler, and Prophy cups. We've talked about managing sensitivity during cleanings using products like Sensodyne and numbing agents. We've addressed the special considerations for those with braces, crowns, and veneers, and the importance of regular cleanings to prevent dental problems. We've even touched on at-home dental care, recommending devices like the soft bristle toothbrush, electric toothbrush, water pick, and floss. Now, as we wrap up, remember that your dental health is a journey, and we're here to guide you every step of the way. So why not share your own dental care tips in the comments below? I'd love to hear from you. And don't forget to hit that subscribe button to stay updated on all things dental health. Thank you for your time, and remember, your smile is one of your greatest assets, so take good care of it.